Assalamualaikum warahmatullahi wabarakatuh. We are from Group 4. We will be presenting musculoskeletal disease, which is a herniated disc. A herniated disc, which is also called bulge, slip, or rupture, is a piece of disc nucleus that is shoved out of the annulus into the spinal canal between a tear or rupture in the annulus. Discs that become herniated usually are in an early stage of degeneration. The spinal canal has a little room which is insufficient for the spinal nerve and the displaced herniated disc fragment. Due to this replacement, the disc squeezes on spinal nerves, often cause pain which may be critical. Place of occurrence. Herniated discs can happen in any segment of the spine. Herniated discs are more known in the lower back or lumbar spine, but also take place in the neck, which is cervical spine. In which pain is encountered depends on what part of the spine is damaged. And the causes. Too much force exerted may cause herniated disc. This material stops producing naturally as it getting mature from time to time, and the ligaments that keep it in the same position getting more fragile. As it stops reproducing, even a small movement or activity can affect the disc, which will result to rupture. Someone might become more prone to disc injury and will likely be affected by herniated disc in one or two places along the spine. Symptoms. The symptoms are based on the spot of the herniated disc and the size of the herniation. When herniated disc is not squeezed on the nerve, the patient may encounter a little backache or no pain at all. If it is squeezing on the nerve, agony may occur. Insensibility or fragility surround the region of the body to which the nerve transmitted. Commonly, a herniated disc is prefixed by an event of low back pain or a long chapter of intermittent events of low back pain. Lumbar spine or the lower back part, sciatica radiculopathy, regularly affect from a herniated disc in the lower back. Squeezing on one or particular nerves that play a part to the sciatic nerve, in which can result to agony, flaring, prickling, and the insensibility that slides the buttock into the leg and occasionally into the foot. Normally, only one side, which is left or right, is damaged. This struggle often reported as stinging and electric shock-like. It might be more critical with standing, walking, or sitting. Aligning the leg on the damaged side can often make strain more unpleasant.
Lumbar spine pain will be developed when we are doing heavy jobs, such as lifting heavy or bulky loads or carrying loads awkwardly, possibly one-handed. The job that can be related to this job task is construction workers.
Cervical spine or the neck part, cervical radiculopathy is the indicator of nerve compression in the neck, which may involve dull or sharp pain in the neck or in the middle of the shoulder blades, pain that scatters down the arm to the hand or fingers, or insensibility or prickling in the shoulder or arm.
The cervical spine pain, the pain possibly caused by muscle strains, overuse such as too many hours hunched over a computer or a smartphone, often triggers muscle strains. As the person who uses the computer in much of their work, the clerks in the office is having the high chance to get muscle strain and could lead to cervical pain.